BBL here at Pure Plastic Surgery, and we are back with Tuesday Tips. This is our meet every Tuesday afternoon to discuss different topics in plastic surgery and answer your questions. This is the last Tuesday Tips of the year. So after this, we're going in a little holiday break. Tomorrow, I'm going to be with Dr. Earl in his Wednesday Hum Day to discuss statistics of pure plastic surgery, so don't miss that. But today we're going to talk about BBL. What should I know about BBL? And a couple of weeks ago, I did one similar to this one, but about liposuction. What should I know about liposuction? And a lot of people wrote to me that they loved the video because it helped them prepare for the surgery and prepare for the post-op period. But if I can do one tailored to BBL, and of course, so we're going to talk. There are a lot of things that are very similar between liposuction and BBL because most of the surgery of the BBL is actually a liposuction part of it, okay? So what's a BBL, or Brazilian butt lift? Brazilian butt lift, it is not Brazilian and it's not a butt lift. It's basically liposuction with fat transfer to the buttocks or hips, sorry. Why is it called Brazilian butt lift? Well, Brazilian, it wasn't a Brazilian that did it, it wasn't a Brazilian patient. So that was the first that got popularized with this technique. So people started calling it Brazilian. And butt lift because even though you're not lifting it, augmenting it looks like a lift, but it's not actually a lift. Like when we're talking about a breast lift, like we're actually lifting the areola and the breast tissue. On a butt lift, we're not lifting the butt, we're just augmenting it with fat. But by volumizing it, it may look that it lifted up, okay? So that's why it's called Brazilian butt lift. One of the major components, like I said, is the liposuction part of it, or the liposculpture. So why is it so important? Because BBL, what's so amazing about this procedure, it's the sculpting of the body. It's turning the waist narrower, the hips wider, the buttock rounder, shaping the body. And a lot of that is not on the fat transfer part. A lot of that is actually on the liposuction, the removal of fat from certain areas, the injection in certain areas to create the shape that you're looking for. So that's why a lot of the things that I'm going to explain today are going to be very similar to the one in the video about what should I know about liposuction, but I'll review them because it's very important to know about the post-op period and the recovery period of a BBL. Okay, for the fat transfer it's not only to the buttocks. The hips takes a lot of that fat transfer to allow for the continuous shaping of the torso towards the lower body, and also to achieve that hourglass figure. So the hip portion is very important. A lot of people ask me, I don't want augmentation in the buttock, I just want my hip dips fixed. Can you just inject in the hips? Well, again, it's the harmony between everything. So if you just inject fat in the hips, then on a side view or an angle view, it's not going to look harmonious. It's not going to look the same way. It's going to look like I put fat in one area, like a blob of fat, okay? So that's why for a BBL to have a better and good result, even if we're not focusing on volume in the buttock, right? Like the BBL has a lot of flexibility in the sense of what is your goal. And if your goal is not to have a lot of volume in the buttock, then definitely we can focus on hips, but I do have to inject in the buttock. So it gives a roundness, and when you turn, it's not one area augmented and the other flat. It has to be continuous, it has to be harmonious, okay? So the importance is that sculpting, it's continuous between the upper body, the hips, and buttock, okay? So this combination is important. I have other patients that like the more athletic look, and in the more athletic look, the hip dips are actually part of that athletic look. Athletic look is a little bit more narrower on the hips, more projection in the buttock. So people are like, just don't inject in the hips. For them, I do inject a little bit, again, to create that harmony, but focusing on more buttock projection. Okay, so that's a little bit of the flexibility of the BBL. The physiologic changes, this is something I explained in detail with the liposuction video, but I'll go over this topic because I think it's extremely important. Post-operatively, a lot of patients feel scared after the surgery because their heart rate is high, they feel dizzy, they feel lightheaded, they may have a low-grade fever, and they get scared. It's like, something's wrong with me, I need a blood transfusion, I need to go to the hospital. So it's important to understand that with liposuction, a lot of these things are going to happen, and it's normal after liposuction. It's your body's response of the removal of liters of fat in a short amount of period, okay? So obviously we're not talking about heart rates that are extremely elevated, blood pressure that's very like lower, very critical levels of blood pressure, no. But a little bit of a heart rate elevated between 100 and 110, 115, that's very normal after liposuction. To have your blood pressure a little bit on the lower side, on the 100 over 60s, over 70s, that's normal. To feel dizzy when you're changing positions, that's normal too. That's called orthostatic changes. That means that your blood pressure is a little bit lower than normal or than your normal. And when you're standing up, your body's trying to adjust to that change, and that's why you feel a little dizzy. So all of that is normal in the early post-op period. And that is why hydration is extremely important, okay? The fact that your body is adjusting has to do a lot with the fluid changes that happen after liposuction. I remove fat, so your body is trying to compensate for that removal of liters of fat. It's increasing the inflammatory response in the body, which causes fluid to leak out of the cells, and that's what's causing the swelling in your body. So the blood vessels are losing fluid to your cells, through your cells, and the cells are swelling up. So the amount of fluid that's actually in your blood vessels is low. So all of this fluid changes and physiologic changes, that it's a lot more complex than I'm explaining here, right? This is just like a very, very small area, that very light explanation of the physiologic changes that happen. But just so you understand that there's a lot going on in your body, even if you're just seeing an incision this big. And the way that you help your body kind of adjust to all of that and feel better is by hydration, okay? That is why your goal should be to drink 1 to 2 gallons of fluid a day. That's a lot of fluids, okay? And after liposuction and a BBL procedure, it's very common that you are full, that because you're tired, you're actually not hungry, you don't have an appetite, you don't want, and you get full easily because the faja and the garment is so tight. So you have to keep drinking and logging how much you're drinking, so you make sure that you are taking the amount of fluid that you need to, okay? Let's talk a little bit about the ultrasound before I continue with the post-op regimen. The ultrasound is one of the most important aspects for me for the BBL. It's making this procedure safe, right? So BBL, it's a relatively newer procedure in plastic surgery. Moving fat from one area from one area of the body to the other is not new in plastic surgery, but the sculpting of the body and transferring, especially to the hips and buttocks, for aesthetic purposes, it is something relatively new. We're talking about the last 5 to 10 years that we've seen the popularity of this procedure increase and increase. And with that, we've seen the complications of it, okay? So early on, when this started to get popular in 2016, 2017, we started to see around 2018, 2019, a lot of complications regarding fat embolism, okay? So what is that? It's a piece of our globule of fat injected in the buttock, travels to your lungs, and can be very dangerous and even fatal. Have patients that have passed, you've seen it in the news, unfortunately, due to fat embolism. So around that time, 2018, 2019, a group of plastic surgeons internationally and also in the US got together to see if this procedure could be done safely or it had needed to be banned. We need to stop this procedure because it's not safe. And they started researching and investigating each and every one of these cases. What happened, what happened specifically to where the fat was injected, how the fat got to the venous system, up to the lungs, and if there's a way of doing this surgery safely and without this risk. And they found, and this was, like I said, not only in the US but internationally, and a task force of plastic surgeons got together and found out what was going on and gave some recommendations to avoid fat embolism after a BBL. One of them, and the most important, is injecting the fat in the subcutaneous space, okay? So we have the muscle, which is the deeper structure. We have the skin, and in between this, we have the subcutaneous fat, okay? Before or early on with the BBL, we were not we, because I wasn't doing the procedure at that time. Surgeons were injecting in the muscle because in the muscle, you can get more volume and maximize the expansion and give very drastic changes with one round of surgery. So they were actually purposely injecting in the muscle. But when this task force got together, they found out that in this muscle, specifically in the gluteus muscle, there are some big veins that travel to your lungs directly through the pelvic veins and go directly to the vena cava. So that was the route where the fat was going to the lung. So then they started seeing that on the patients that they injected in the subcutaneous space, so above the muscle, this didn't happen. So that is the way that you can safely do this procedure without the risk of fat embolism. Just inject the fat in the subcutaneous space, not in the muscle, just in the subcutaneous space, which is this space here, okay? How do we know if we're injecting in the subcutaneous space? So that is how I perform all of my procedures, just to confirm and to be 100% sure that I'm injecting in the right plane and not injected in the muscle. I use the ultrasound. An ultrasound is a device used for different purposes. More commonly and more the usual and the most common usage of the ultrasound is when you're pregnant. You use the ultrasound to see the baby, and that tells you that the ultrasound energy, it's a very safe radiological imaging device, safe that you can see a baby, right? So similar, this is the one that I use, okay? So it's an imaging device. This transmits waves through the skin, through the muscle, and back, and puts it in an imaging that I'm seeing the different layers, and I'm seeing where I'm injecting with the cannula directly in the subcutaneous space and not in the muscle. So this is one of the brands available, the one that I have here and we use at Pure. It's called Clarius, that's the brand that we have, and it's portable, it's wireless, so it connects, and when I'm sterile in the operating room, I put it in a sterile bag, so this is not in direct contact with the patient, it's in a bag sterilely, and I use it in every single fat transfer case to make sure that I'm injecting in the right plane. And this here is a little video of how do I see it. So basically this is what I see. This is literally a picture of this iPad because I use this iPad in the operating room. And basically all this white lines is what I see. And you can see in the lower part of the picture here, there where you see that it's more gray and like striated, that's the muscle where he's pointing here. That's the muscle here. So above, and this over here is the skin. So all of this space is the subcutaneous space, and that's where I put the cannula. In a little bit you'll see that I'm putting in the cannula And this line here, white line, that's my cannula. And you can see that in a minute, I'm gonna be moving it up and down to make sure that that's my cannula. And then I start injecting, and you see the globules of fat staying in the subcutaneous space and not going into the muscle, okay? So that is one of the most important aspects of the BBL, to make it safe, to make it a procedure that is consistently safe for every patient. So I use it in every single case, okay? And going to the post-op, again, this is gonna be very similar to the liposuction video, because most of the things are very similar on the post-op course. So we talked about hydration, super important. Massages, super important, okay? The liposuction empties the space of the subcutaneous fat, but it's up to the skin to contract to give that final contour. How do we help the skin to contract? Massages and compression, okay? Massages, you're gonna start them as soon as the next day. Usually in the entire post-op course, at least 20 massages. Everybody's different. If you have prior liposuction, if you have poor skin quality, multiple pregnancies, weight loss, thin skin, striae, all of that, you probably are gonna need more massages to try to get that skin and avoid skin to retract and avoid contour irregularities. And for the massages, they are also very good for the fluid buildup, okay? We talked about the swelling, and there's a lot of fluid involved, okay? So the massages help drain that fluid. Don't be scared in the first 24 to 48 hours, there's gonna be a lot of leakage, okay? There's a lot of fluid I put in for the liposuction, and that leaks in the first 24 to 48 hours. A lot of people get scared because it's saline mixed with blood, so it tends to look very red, and people think they're bleeding out. But it's not. It's just part of the fluid that continues to leak after the surgery, okay? So if you see that afterwards, or you're seeing videos or pictures of post-op patients, you're like, what is this bloody mess? Why are they leaking so much? It's part of that fluid, okay? It's very common after liposuction. Compression is super important. I use, and I recommend for my patients, 2 stages of fajas, the compression garment. The stage 1 is the low compression garment. It's to protect your skin for the first 7 to 10 days. And then after that is when you switch to a stage 2. The stage 1, we're gonna give it to you here. So when you wake up, the faja is gonna be on already. And then the stage 2, you'll buy later on, but don't buy it before, because you won't know your size. You have to wait at least 5 to 7 days after the surgery to get measured, and then you can buy the stage 2, okay? Fat survival is one of the most important, or one of the most tricky parts of this procedure. Not all the fat that I put in is gonna survive, okay? The fat, when I move it to another area, right, I'm taking it out. I'm not taking it with a blood vessel, right? I'm taking dirt with a flour from one area and transposing it to another area. And that flour needs to grow new roots and survive in its new ground. And that's basically what I'm doing with the fat. So while these roots or the new blood vessels grow in the hips and buttock area, takes time. Takes approximately 6 weeks for that to happen. So in that time, not every single flower is going to survive, okay? So how much survives? Approximately 70 to 80% of what I put in survives, okay? How do I optimize how much fat survives? 1, your diet, and 2, the pressure, okay? So you shouldn't put any pressure to the fat grafted areas for those first 6 weeks to avoid fat necrosis and fat death, right? So it doesn't survive. It resorbs. Diet and exercise is extremely important. Diet, especially in the first few days, the most important thing is to be low in sodium. You're gonna get very swollen. If you eat salty foods, you're gonna get more swollen. So the only thing you should avoid in the first week or 2 is salty diet, so salty foods, okay? And then you're gonna focus on eating healthy fats. What are healthy fats? yogurts, avocado, salmon, nuts, yes, all of that. The dairies are regular yogurt, ice cream, okay? So that is important, so we optimize the fat survival, okay? And then in the long run, once after those first 6 weeks, the fat that survived. So now what's there in your hips and buttocks, it's your fat, and it's gonna change with your weight changes. So if you gain weight, that's gonna increase. If you lose weight, that's gonna decrease. Same way the fat in your belly changed when you changed weight, right? It's your fat in another area, okay? So the consistency and the keeping your results is focused on this, on diet and exercise, so your results are optimized and are there for the longest, okay? I'll take some questions now.
Okay.
Yes.
Let's go with the first one, and this says, can I add arm lipo with my mommy makeover?
So yes, it is a very common area to add with the mommy makeover. Arm liposuction, it's a small incision here near the elbow, and it takes care of this fat, this naughty fat that builds up in this area. It depends if you have skin laxity or not, okay? If you do, I do recommend adding body tight. Body tight is radio frequency energy. Why? Because the arms have very thin skin. Doesn't contract very well like other areas of the body. So if you do have a little bit of skin laxity, it's better to add body tight to contour better the arms. But yes, it is a very common add-on with a mommy makeover, and also you can do it with a BBL if you're having a BBL.
Okay, this one comes from YouTube and says, how do we resolve visceral fat after liposuction?
Very good question. Okay, so I'll draw it here. So if you're looking at yourself on this side, we have skin. This is skin. We have muscle. This is the subcutaneous fat. And then inside we have our organs, and we have visceral fat, okay? Visceral fat, when we're doing liposuction, we empty this space. And this, we make it thinner. We can make it up to here, right? Very thin. But if you do have a lot of visceral fat, you're still gonna look bulgy. You're still gonna look like your belly is not flat. And unfortunately, the only way of losing visceral fat is with diet and exercise to lose the weight.
What about an arm lift with a mommy makeover after 100-pound weight loss?
Yes, very, very common. One of the most common combinations with the mommy makeover surgically, it's an arm lift or a brachioplasty, and Dr. Earl calls that the trifecta perfecta. We do help each other out to make that surgery, which is the longest surgery that we do here, shorter, so the recovery is better and you're less time under anesthesia. But yes, for weight loss patients, that it is an option to combine the three: the breast procedure, the arm lift, and the tummy tuck.
How long can I go back to work after my tummy tuck?
So after a tummy tuck, it depends on what you do, okay? Usually by 3 weeks, you'll be able to go back to work, but with the limitation of no heavy lifting. So you can't lift more than 10 pounds until you're 6 weeks out, okay? So it depends on your work, and it depends on if they can do light work for you, if you have to lift heavy stuff in your job. But usually by 3 weeks, your drains are gonna be removed and you'll be able to be more comfortable. But you have to still wear the faja and still not lift anything more than 10 pounds.
Well, I don't know this question, but just says muscle repair / the swelling.
Muscle repair / swelling.
Mm.
I mean, there is swelling with the muscle repair. Whenever I do a tummy tuck, I'll see that the patients always have a lot of swelling in this area, and that's related to the muscle repair itself, and also in the areas of liposuction. That is gonna come down a lot. You'll see in the first 6 weeks, you'll see a very marked decrease in the swelling. and then slowly up to a year you can see swelling after a tummy tuck, okay? And the combination of the muscle repair, the skin excision, and the liposuction has to do with the length of the swelling associated with a tummy tuck.
Safety question.
I like it.
Are there any safe guidelines you follow while performing lipo? You mentioned that you use an ultrasound for fat transfer to the butt. Is there anything for lipo to avoid complications?
Yes, definitely. So the I guess the three most common or most important complications to avoid with liposuction is one, infection. So safety guidelines that we do, one is I'm going to put you on antibiotics for a week after the procedure to decrease risk of infection, and our sterile and aseptic techniques that we have here at Pure are very strict. And that is why our infection rates are very, very low. And also our prepping or our aseptic cleaning of the patient before starting the procedure. Okay. The other one is the surgery itself. So one of the techniques that I use is the angle of the cannula is extremely important. When I'm doing the liposuction, I am using my other hand to orient myself at all times to make sure I'm not going deep or too superficial that it can cause a lipo burn. And the other one, which is extremely important, it's the fluid or the physiologic changes that can happen and cause dehydration, anemia. And that is why we limit the amount of fat removal on a liposuction case to a max of 4 liters, because if we exceed that, then it's too risky for you because of this part. The physiologic changes, inflammatory changes are going to be too rough on your body.
Okay. Can a breast lift be done with Lipo 360 or only a BBL?
So a breast lift, it's a surgical procedure, and when we're doing a breast lift, I can only remove 1 liter of fat with liposuction. So with a breast lift, you can combine certain areas, but usually not a lipo 360. It can be maybe a liposuction of the abdomen only, lipo 180. It can be lipo of the arms, of the bra line area, but it's not going to be enough. Or if I only do 1 liter remover on the 360, it's not gonna make a major change in your body. So I do recommend focusing on a smaller area. Same thing with the BBL. I don't combine it, same thing, because of the limit of the fat removal. And especially with the BBL, you're gonna be in your breast basically. So with a BBL, I'm gonna ask you to be sleeping in your belly and in your torso and your anterior torso. So you're gonna be putting pressure to the breast. So I don't like to combine breast procedures with a BBL.
Okay. Do you look at our photos that we sent in before getting a quote?
Of course, 100%. So whenever you fill in a virtual consultation, you send in your form and your pictures. I evaluate all of that, and I send it to our coordination team with my recommendations regarding the procedure that I think it's going to fit the best to you. And that is when the coordinator gives you a call and discusses this with you.
This is a good one. How long after a tummy tuck or tummy skin removal can you get a BBL?
So after a tummy tuck, you should wait at least 3 to 4 months to have everything heal, and we can go ahead and do a lipo 360 with the fat transfer, which is a BBL. But if you're doing it the other way around, you should wait a little bit longer. If you're doing a BBL and then want to do a tummy tuck, usually there's a lot of scar tissue that forms with the liposuction, and it's better to wait 9 months to a year to have that skin loosen up, and I can tighten you well with a tummy tuck. Okay. So I think we're done. Thank you so much. I posted this earlier this week, or it wasn't last week was. I passed my boards, so I am officially a double board certified plastic surgeon. I know a lot of people are asking me, are you board certified? So until now, I was board eligible. What does that mean? The board certification process for plastic surgery is a 2-year process, okay? Unfortunately, there's no way of doing it faster. Every single plastic surgeon out there that's board certified has gone through this process. And while you're in the process, you are able to call yourself a board eligible plastic surgeon. So up till now, I was a board eligible, but I received my official note last week with the certification, so that I am board certified by the American Board of Surgery, which I've been since 2018, and now by the American Board of Plastic Surgery. So because I have this new certification, we are doing some changes in the prices, and this is the last chance to get in, and there's some specials. So if you're thinking about booking in, send us the virtual consultation or give us a call, and we'll send you the details so we can put you on the schedule. And remember that tomorrow I'm going to be with Dr. Earl in the live Wednesday hump day. So we're going to discuss the statistics for this year 2022 about infections, about complications, about the number of cases we did, and all of that, which is very, very important. So we review our own cases, and we let you know what are the things that we are going to change or improve for next year. So join tomorrow, and have a beautiful, happy holidays, vacation, spend time with family, and I'll see you in 2023 on Tuesday Tips. Bye bye.